Hello, I am Dr. Shuchi Bajaj. In this video, I am going to talk to you about tooth mobility or moving teeth. What are the causes of the same? What are the treatment options do we have? An approximate idea of the cost of these treatment options. So basically the most common cause of tooth mobility in India is periodontitis. Periodontitis is infection of the supporting structures of your tooth. Your tooth, which you see in your mouth, is of course surrounded by gums inside, right? But inside that gums is also bone, which is basically protecting your tooth and keeping the tooth at its proper position. In case that gums and bone gets infected, that is the disease which we call as periodontitis. That is the most common cause of having tooth mobility. There are other causes also, like for example, trauma from occlusal, which is basically wrong bite, when we are biting our teeth in such a position that we are leading it to trauma, which is further moving our teeth. Third is fracture. But because periodontitis is the most common cause, I am going to talk more about the treatment options for the same. If we talk about treatment options, then if your teeth are mobile but they are only grade 1 mobile, that means they are moving but they are not moving more than 1 mm or 2 mm, then in those cases we usually clean the gums, we usually clean the bone. Also advise patient to take certain antibiotics, maybe local or they have to take it or some capsules and tablets, and along with that we reduce the infection, improve the supportive structure of the tooth, and this way we make the teeth immobile. We stop the mobility of the tooth. This is the most common option. We call it scaling, root planning and curettage. This is also very reasonable option. The treatment starts from approximately 1000 rupees and it depends on how many sittings you may require. Second option is splinting. When your teeth are moving but even after cleaning we are not able to bring them back into normal position because the bone loss has happened to a higher extent, in such cases we splint your teeth. For instance, whenever you must have heard if somebody gets a fracture, the bones are brought together and they are made immobilized using a plaster. Similarly, we make your teeth immobile by bonding them together using the supportive strong teeth from the adjacent areas. This process is called as splinting. In this the costing is little higher. It depends how many teeth are involved. Approximately cost is 1000 rupees per tooth and it varies according to number of teeth that require the splinting process. Third option is sometimes when the spaces have come in between the teeth are not just mobility, they have also having huge spaces between them. In such cases we need to give them bridge. Bridge is nothing but multiple caps fused together. In such cases treatment is little more expensive because one cap will cost you minimum of rupees 2000. There is a vast range in the same and it will depend on how many caps you require. In such cases sometimes root canal is also required and you can add additional cost of the same. Fourth option is bone grafting along with flap surgery. Sometimes when the tooth mobility has happened and lot of bone loss has happened, in those cases cleaning is not sufficient. We need to add artificial bone to the area also. That is the time when we add bone graft, which is like an artificial bone which we put inside your gums. This treatment has little less success rate, so this is not my first preferred treatment of choice. But in certain cases, yes, we do that. It is very important that if you go for a flap surgery and bone grafting, you maintain very good hygiene after that. Because if you do not maintain hygiene, then the treatment success rate becomes very less. Hope I was able to explain you the causes and various treatment options. If you like my video, please like and share the video and also subscribe to my channel. Thank you.